3 doctors versus Chat GPT. So artificial intelligence is here, and we're going to put it to the test with some real-world medical questions. Can AI replace the job of doctors? Let's find out.
So we have like a few different specialties up on stage here, and Dr. John Go is an ophthalmologist. So here's a question. If I'm someone who has cataracts, when is the best time I should get surgery?
The time to do surgery shouldn't be when any doctor tells you to do so, but rather the time to do surgery is really when you feel like your vision is impacting your quality of life. So there are patients who come to me and they say, hey, Dr. Go, my vision's a little blurry. There might be 20/70 or so, but they're just at home. They're sitting there. They don't need really fine vision and their quality of life's not affected. Then we can watch it. We don't have to do surgery. And I get patients who are 20/20, 20/25 who just can't stand glare or halos, or their job, like they might be a pilot or something. Their job might require really sharp vision. That would satisfy the requirement to do surgery. For me, all surgeons have different criteria to proceed with surgery. But for me, it's when your vision, your quality of vision impacts your quality of life or you from doing what you need to be doing.
Well, according to Chat GPT, the decision of when to get cataract surgery is ultimately up to you and your eye doctor. However, in general, cataract surgery is recommended when your vision begins to interfere with your daily activities, such as reading, driving, or watching TV.
Okay, it's not wrong.
If you have concerns about your cataracts or experiencing changes in your vision, it's recommended you consult your eye doctor. ChatGPT is playing it safe and claiming to not be a doctor.
Yeah, for legal purposes.
Yeah, exactly.
Yeah, I guess so.
I think I have ADHD. What do I do? If you suspect that you have ADHD, it is important to seek professional evaluation and diagnosis from a licensed mental health professional or medical doctor. 1, talk to your primary care doctor or mental health professional. Number 2, get a comprehensive evaluation. Comprehensive will typically involve a clinical interview, behavioral rating scales, and other assessments. Number 3, follow recommended treatment. 4, learn more about ADHD.
So this is pretty useless answer.
Read books, yeah. Like, look at websites. But the reason why I'm asking this question, it
Yeah.
seems like a lot of these questions need like follow-up questions.
Mm-hmm.
What are these behavioral rating scales? They are standardized tools used to evaluate a person's behavior.
So they don't tell you what they are. It just tells you, it's giving a definition of what that means. But
oh no, there's more. Some common behavioral rating scales used to diagnose ADHD include, there's 4 of them. Conners rating scales, ADHD rating scale 4, Vanderbilt assessment scale, behavior assessment system for children. But it's still not even helpful. It's like listing the scales for me, but it's not telling me like what it is, how to use it.
You have to follow up with it and ask what are the criteria of each scale.
Yeah.
Can you ask it like, can you administer one of these scales to me?
As an AI language model, I am not qualified to administer the Conners rating scales.
Okay, well, it's smart. I guess. They're still covering their ass about this. The first thing as a provider you would have to ask is, what makes you think you have ADHD?
Yeah.
I think just the history is the most important thing, because I think ADHD is something that's so colloquially thrown around on the internet. That everyone says they have ADHD.
Yeah.
And right now, I think there's an Adderall shortage in this country too, because it's just being so rapidly prescribed, and they're running short of it, and everyone's saying they have it. So the most important thing is to figure out like what symptoms do you have, because with the rise of distraction, like social media, technology and stuff,
digital distraction.
People are just more distractible in general, and that might just make people feel like they have ADHD. But I think like diagnostically for ADHD as a clinician, like there's like a few criteria that are really important. You need like a few different symptoms from like other categories, like impulsivity category versus restlessness category, and you also need to have them in 2 different settings. So it has to be like, if my child has ADHD, is it at school and at home? Is it at work and at school? Is it at like during sports and at home? Because if it's just only in one location, that just might be a bad environment for them. But if it's in multiple places, then it's more likely that they have ADHD at a baseline.
That's a good point.
All places.
Yeah.
I think one thing I would probably add is make sure that it's not affecting your ability to function normally.
Right.
Like-
Because then it wouldn't actually be an issue. That could just be like a character trait.
Yeah.
Right.
Yeah. So like for our audience, a lot of people come to us and ask, I think I have ADHD. I can't focus. I can't retain what I've learned. Like that's a common one I've seen.
Right.
That might not be ADHD. You know, that might just be like your study technique or something. But
Yeah.
we don't know. Right. So so the symptoms, like you said, and then the other thing, think about what else it could be. Maybe like, are they just really anxious all the time, or like restless? It could be maybe depression or something like that. I guess it could be a whole slew of things.
The main thing from a medical or psychiatric standpoint is that ADHD is a clinical diagnosis. There's no like specific test you can run to diagnose ADHD. So it is very subjective based on the information that you're providing.
To sum it up, like if you think you have ADHD, you can go online and find self-assessment to see like how much you match that assessment. If that assessment says that you might have ADHD and you feel like it's affecting your life, then you should go take that assessment and bring it with you to the doctor and discuss it there.
All right, so let's say that I'm a young parent, maybe like 22 years old, don't really know much what's going on, but my kid, who's 2 years old, just swallows a battery. What should I do?
I think one common thing that people might think to do is to try to fix it at home by getting the kid to like vomit up the battery, like try to induce vomiting.
Right.
And I'd say you should not do that. It's pretty dangerous.
Right. That's that is not the right answer.
So that's first thing that you should do. Second thing is get to the emergency room and figure out where it is, figure out where it's lodged, and have a professional take care of it.
Basically surgery.
A camera, yeah.
Yeah, because if I remember, like what could happen is like that battery is going to dissolve in their throat within like 2 or 3 hours, and then it's just going to burn their entire GI tract.
Yeah.
And kill the kid.
So you need to be get to the ER immediately, basically.
Pretty quickly.
Yeah.
Rapidly. That is an emergency for sure.
So swallowing a battery can be a serious situation, especially for young children. Batteries can cause chemical burns or other injuries to the digestive tract and cause serious harm or even death if not addressed promptly. Here are some steps you should take if your child has swallowed battery. Number 1, call your local emergency services or go to the emergency room immediately. Time is of the essence when a battery is swallowed. Do not induce vomiting or give your child anything to eat or drink unless instructed to do so by the healthcare professional. Bring the battery or battery packaging with you to the emergency room. This will help healthcare professionals identify the type of battery and provide appropriate treatment.
Pretty good. That was pretty
Nail
thorough.
on the head.
That was pretty thorough. What happens if you accidentally get like some chemical like bleach in your eye? What do you do?
So the first thing that you do is irrigate copiously. Because
For how long?
Like at least 15 minutes, 20 minutes, and also go to the emergency room.
Just so people know what irrigation and copious means.
Okay, so it's wash your eye out a lot. Bleach in particular, I think, is very basic and like pH basic, and it's very, very damaging to your tissues. So it's important to get as much of that out as you can and go to the emergency room. In the emergency room, they'll probably call an ophthalmologist to evaluate and to look at your eye. But yeah, rinse it out as much as you can. If you have an eye wash station, use that. And wear eye protection next time. Yeah.
Sounds good. But Chat GPT here is saying use a gentle stream of cool, clean water to rinse your eye for 15 minutes. It sounds not very urgent.
Like you don't want like a fire hose of water going in your eye.
Fire hydrant, yeah.
Because one of the concerns is now that your cornea is damaged, so you don't want any forces on it any excessive forces impacting your eye. But yeah, definitely urgently rinse it out. Yeah.
How do you do that at home? You just like eye under the sink? You're just like...
I guess so.
I remember in chem lab, they have like those two things that like
they
shoot
shoot
out
that way. But if you're at home, what do you do? You just go to the shower and just like...
I like how some showers have like the spout on the bottom. Just get as much water as you can in
just
there.
like lay down in the bathtub.
I guess, yeah.
Your eye.
So the point is you need to have running water, right?
Running water.
You can't just like fill a sink with stagnant water and dip your face in there.
Right.
That doesn't work. You have to actually run the stream.
Right.
Here's another eye question. Why do my eyes turn red when I smoke weed?
THC binds to...
Wait, keep going with this.
THC binds to cannabinoid receptors, and they vasodilate the vessels on the clear part of the clear coating over the white part of your eye. The vessels enlarge, and that causes redness of your eye. It does that throughout your body, though. So that's why some people get super lightheaded, because all their blood is going to these vessels that are getting bigger. Yeah.
One of the most common side effects of smoking weed is red eyes. This occurs because THC, the active ingredient in cannabis, causes blood vessels in the eyes to dilate or expand. Literally what you said. THC also affects the body's autonomic nervous system. So like you said, it's just the whole body.
Ask Chat GPT what animal or what organism has the largest eyeball.
Do you know the answer to that?
It's not a whale though? And the whale's like the biggest animal, isn't it?
So if my memory serves me correctly, it's the giant squid.
Oh.
The animal with the largest eyeball relative to its body size is the giant squid.
It's hit or miss, right? But I think it's actually pretty solid with giving a good differential, safe, conservative list of things that it could be. I don't think it's going to ever replace, or not ever, I should say. At present, I don't think that it should or could replace a medical professional. There are things that doctors and psychiatrists and nurses do that Chat GPT can't do. Part of that being the physical exam, and part of it also being the art of medicine. You know, we all have really unique experiences that we take with us going forward in our practice of medicine. And at least at present, I don't think that Chat GPT can really replace that.
I totally agree. Like the empathy is what Chat GPT cannot replace. Like I was trying to think of a question to ask Chat GPT where, because I've had experiences where I was talking to patients where I felt like there's some sort of neglect or some sort of like domestic violence at home, that the patient, when the patient's there like with their significant other, like they're pressured to not reveal it because like when they go home it could result in bad consequences.
Right.
But like there's things that a physician or a nurse can do, like to read body language and to like kind of listen to the words between the lines that ChatGPT just can't do.
Right.
And ChatGPT can't ask follow-up questions in that way too. Yeah, if anything, I'm sure it's going to make the job of doctors or anyone's job easier. A patient at home cannot play doctor on themselves because they don't necessarily know what the questions to ask.
That's true. Until they make a Chat GPT that gives you prompts.
Exactly.
Right.
Yeah.
Like a branching options when you choose one.
Yeah.
To diagnose yourself.
Man, I've had so many situations when patients come in and say everything hurts.
Yeah, it's just that's like
what do you
that's the
say
worst.
next?
That's the worst
Yeah.
thing they can say, and then you have
Yeah.
to just keep prying and keep asking better questions, because that's the only way we can really help is if we have a clear understanding of what's going on.
Yeah.
I'm really curious, so I'm gonna just ask ChatGPT that.
What?
See what it
Everything
says.
hurts?
Everything hurts. What do I do?
Yeah.
Identify the cause of your pain is the
Yeah.
first thing it says, but we don't know because everything hurts.
That's what we're trying to do. I mean, but yeah, other than that, like I do agree with you guys though that it's not ready to replace actual people yet, because it still needs someone to put the prompts in.
Can't wait to see where it's going to go, where it's going to take the human race.
Yeah.
I think it's pretty exciting, if anything.
Yeah.
But yeah, thanks for joining us, and until next time.